This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, as always, welcome back, and thanks for watching the program. Well, it's healthcare is always in the news. Joining us is one of the experts we call in from time to time, Dr. Stuart Shapiro. He heads the Pennsylvania Healthcare Association. Doctor, welcome, as always.
Good morning.
All right, well, let's get right to it, as they say. We have a number of important healthcare subjects to get into. As you know, the legislature is deep into the budget. So they're not talking about numbers right now. They're doing some other things. I'll talk to our guests coming up that don't deal with healthcare matters. But we have Medicaid expansion. We have concern for senior citizens and, you know, what should be done to help them. We have this ongoing debate over tort reform. What do you want to start with? I'll let you decide.
Well, why don't we talk a little bit about baseball today?
Oh, baseball?
Where I'm the
We're not
umpire.
talking about football, right?
No, I'm the umpire,
Okay.
as you know here, and I call balls and strikes, as I call it.
Okay.
Well, neither the Phillies nor the Pirates are doing well this year. The economy is, and that bodes very well for the state budget and for health care. And I hope it bodes very well for seniors. Let me put some meat on those bones. First, when Governor Wolf proposed his budget, there was a $2.3 billion deficit. And he proposed a budget, in his view, how to fix that. Since then, the economy's really shown some rapid improvement. Tax collections this year, through the end of April, are up almost $600 million better than projected. So the deficit is now $1.5, $1.6 million.
Still sizable.
Still sizable, but much more manageable.
Right.
And the good news is that maybe we can make seniors this year a real priority. Mm-hmm. The governor, during his election campaign, talked about making seniors a priority. With that, and during his proposed budget, he treated them well, but there's still considerably more that can be done. And we're hoping that now, with the budget deficit being far less, that seniors are not left by the wayside, and especially those frail and elderly seniors who are in nursing homes. Mm-hmm. Let me take it a step below that. The cost for nursing home care has gone up almost 3% a year for the last 3 years. Yet the budget is flat.
Right.
Nursing homes have been forced to cut staff, delay capital improvements, watch things a little bit deteriorate, although the quality has continued to improve. In Pennsylvania, the statistics from the federal government have said Pennsylvania has improved in its nursing homes in 10 out of 11 areas. So quality is going up.
Now, the long-term implications for not making the capital improvements and internally doing the things can ultimately be very harmful, correct?
Correct. And we've got to stop the slide. And so we're very hopeful that the legislature, working with the governor, will say this is the year to start to address some very, very serious issues. Right now, the average cost of care in a nursing home for someone on Medicaid is $23 higher than Medicaid reimburses. And while I don't like to say nursing homes lose money on Medicaid, what they don't have is reimbursement that covers the cost. Now's the year, with the budget deficit shrinking, to say let's give 2.5% increase to nursing homes. If the government were to say we'll spend $36 million out of a $30 billion budget, $36 million more, that'll bring in close to another 40 of federal dollars.
Right.
So it's a two-for-oneer, where the federal government will help pay to support our seniors. And all I can say is I hope that as the budget deficit decreases, as the economy improves, that the elderly, especially the frail elderly who need care, receive some of those dollars.
We have, Dr. Shapiro will correct me, I think the fourth largest senior population in the country, large seniors, particularly living in rural areas, although they live in urban areas as well. We tend not to think of the rural health care needs. All right. As a way to get into the cost of this, some of it has to do with liability and tort reform and the relationship between plaintiff lawyers and physicians and hospitals and other folks in the medical community. Where does all that stand? From time to time, we like to do an update on that.
Well, Pennsylvania has some of the best hospitals, some of the best nursing homes, some of the best doctors in the country. Yet, lawyers come from out of state. In fact, recently, there have been 2 law firms, one from Florida, one from Mississippi. They fly to Pennsylvania and they place lots and lots of ads. And I'll give you an example.
I see them on TV.
And you see them in the newspapers. And one law firm has put in 30 full-page ads since January 15th against nursing homes. And there's also ads against doctors and hospitals. But let's talk nursing homes for just a second. They've placed over 30 ads. Some of these are against nursing homes that have been deficiency-free for 3 years. In fact, there's one in the eastern part of the state that won the award 3 years in a row from the state health department as one of the best nursing homes in the country, and is loved by its residents. The staff is committed, yet they're tasting out full-page ads. These are law firms from the South who fly up here because of the environment for frivolous lawsuits. Now, they're not, then what they do is they put investigators in the parking lot of nursing homes or doctor's offices or hospitals.
Are these fishing expeditions?
Oh, they're 100% fishing expeditions. Then they file lawsuits. Then they don't even want to take the cases to court. They go to the insurance companies and they say, we'll settle it for X. And the insurance companies say, okay, we'll settle it because they don't want to risk punitive damages in some of the courts. So they settle these cases. People who work there go into a supermarket and people come up to them and say, what's the matter with your nurse where you work? Makes the employees feel bad. There is no justification for bad care. And lawyers ought to be able to sue doctors or hospitals or nursing homes.
If there's bad care.
If there's bad care. But when care is good, for out-of-state lawyers to blackmail the health care providers in the state only raises the cost. And when you look at these costs, we talked about Medicaid last year, in 2013, $91 million was spent by nursing homes in order to defend and pay out settlements. That's $91 million that could reduce the cost. Those are dollars that aren't going to patient care. They're not going to providers of care. They're going to out-of-state predatory lawyers who come to this state. And we are hopeful. The business community is hopeful. The healthcare community is hopeful that the legislature will address this issue.
Now, they made some changes a few years ago. You want additional changes, correct?
They made some changes, and one of those changes was very helpful. It said there's going to be a cap, not on damages, but on punitive damages for physicians.
Right.
Once that happened, the number of lawsuits against physicians went boom.
Yes, I read about it just in the press recently.
Right. Those same protections don't exist for nursing homes today. So it eliminated the frivolous lawsuits when it happened against doctors, but still there's cases against doctors. There was one in that same article that I'm sure you read about a $10 million settlement against the doctor who made a mistake. And those ought to be there. But the frivolous lawsuits that just gobble up the state's Medicaid dollars at a time when we don't have that, where the money doesn't stay in Pennsylvania, a big piece of it goes to these predatory law firms that take 50%, 40% of the settlement dollars, goes into their back pocket and leaves Pennsylvania. And that's just wrong.
Okay, well, look, thanks for coming in. We'll see you next month for another one of our healthcare updates.